So, hi everyone. My name is Afelista Wamboi Abdallah. I am the National Coordinator of the Kenya Sex Workers Alliance. I am a Kenyan sex worker. I am also sitting on the board of GNP Plus, a global network of people living with HIV, and I'm the Vice President of the NSWP, the Global Network of Sex Workers Projects. Thank you. So in my presentation today, I would also like to talk about the organization that I represent, that is the Kenya Sex Workers Alliance. So KESWA is the umbrella body of sex workers-led organizations in Kenya. It was formed in 2010. It is registered as a non-governmental organization. KESWA identifies diversity. So we work with male, female, and transgender sex workers who are using drugs, and those living with HIV. So KESWA prides itself on achieving meaningful participation of sex workers at every level of decision-making on its programming functions, structures, and system by amplifying the principle of nothing for us without us. First, I will be looking at the status of sex work in Kenya. The legal environment can play a powerful role in well-being of sex workers. It can create a third section culture of stigma, discrimination and exploitation and extortion of sex workers. This in turn will make our population harder to reach, ultimately impacting our access to services and endangering us even more. Though sex work is based on the provisions of the penal code here in Kenya, which criminalizes sex work related activities, but not the sex work itself. By criminalizing behavior relating to sex workers, the legal environment contributes directly to the social exclusion and other abuses that are experienced by sex workers. Kenya has identified the need to acknowledge that HIV, biomedical, and behavioral interventions are not sufficient against us. To this end, key government policies on HIV are now taking cue from the Constitutional Bill of Rights to address the higher prevalence among sex workers by proposing human rights-based approach in recognition of the role of human rights and violations in perpetuating vulnerability of HIV. The Kenya AIDS Strategic Framework, that is the CAS 2014, 2015, 2018, 2019, and the NAC 2015 in the Strategic Direction 3 highlights interventions for the protection of rights of PLHIV and key population, identifying sex workers as a priority population in this regard. Decriminalization. Decriminalization removes repeals all criminal laws that prohibit sex work itself, along with all associated activities. Decriminalization should also encompass the removal of all legal oppression beyond criminal laws, including laws that disappropriately impact sex workers' lives, which laws against vagrancy, public nuisance, drug use, homosexuality, cross-dressing, discrimination improves the safety of sex work by reducing the work related to violence, including police violence and which is increasing access to justice, to support services and health services, legally recognition. Sex work as work also reduces the stigma, discrimination, and harassment as sex workers have been faced or experienced. Our partners and families, it is experienced by us, our partners or our families. It is also affords us as sex workers the same rights and social protections as other workers, improving our opportunities and economic empowerment under decriminalization. Sex workers no longer fear arrest, imprisonment, deportation, or having a criminal record because of their work or our work. Decriminalization and sex work. Implementation of the Disorderly Houses Amendment in Act in Australia in the 1995 And the Prostitution Reform Act in New Zealand in 2003 had many leading international human rights organizations have called for decriminalization of sex work, including WHO, UNFPA, Human Rights Watch, and Amnesty International, along with medical journal, The Lancet. In Australia alone, the repeal of prostitution laws in 1979 decriminalizes the street-based sex work. A public health study was done in 2010, compared sex workers' health services across the 3 Australia cities with different sex workers' legal models, and concluded that Sydney had the best work safety, peer education, and support measures due to decriminalization and reduces police interventions. In 2012, a report for the Australian Ministry of Health of Sex Workers stated that NSW sex industry had not increased in any size. There were no associated incidents of police corruption, and that sex workers' mental and sexual health was at a similar level to that of the general population. Australia is currently has a liberal sex work legislation, in that sex workers can now report crimes such as thefts or assaults at work without the risk of getting arrested themselves, and can file a complaint if they are not treated fairly by the police. A 2014 study also published in The Lancet indicates that the discrimination of sex workers is that single intervention that would have a greatest impact on the cause of HIV pandemic. Over 10 years, with reductions in new infections among sex workers and their clients estimated at between 33 and 46%. When we look at the New Zealand one again, the Prostitution Reform Act decriminalized sex work in 2003, and removal of all the laws that had criminalized the purchase of, sale, and organization of sexual services. New Zealand Sex Workers Collective, NZPC, has assisted sex workers, have previously related convictions removed, and have consulted with the governments to produce a set of workplace health and safety rules, including an obligation for employees promote safe sexual practices. A law inform immediately, boost labor rights. New Zealand sex workers can report bad managers and unsafe working condition, along with existence the right to refuse or report an unsafe of the client. So they are no longer concerned with having to evade the law. Sex workers can operate in safe environment where it is easier for them to enforce the boundaries that are set. Challenges that are faced by sex workers. We have increased stigma and discrimination due to curfew. Some sex workers have attempted to bring to their clients' homes. In some contexts where neighbors noticed new entering and exiting sex workers have been openly characterized for breaking physical distance rules and placing their communities at further risk for COVID-19. Increased violence. When sex workers visit their client's home, it means the violence is actually increasing. They become vulnerable to physical and sexual violence and not being paid as agreed. Some male clients keep them past curfew hours, which effectively forces them to stay for the night. The men then try to factor in providing a place to sleep, food, and many other things. Other attempts to deduct it from the cost of sex, this has led to disagreements, fights, and even sexual violence. So far, Keswa has lost over 30 sex workers since the pandemic started, who have been murdered in major cities and towns in Kenya. Police violence and harassment. As sex workers generally we must work around schedule of clients. We often miss curfew timelines and therefore become susceptible to police violence and harassment. While in transition, some of our colleagues have reported being forced to secure their freedom from curfew, related prosecution through unprotected sex, as demanded by the law enforcement against sex workers who live in the brothels, have been arrested and taken into quarantine centers, even when the police find them in bed alone. So it has not been safe. Then there's been a limited ability to combat the abuses surrounding curfew, as the quarantine system bypass and suspends any judicial procedures or due process. Factors that increase sex workers' health: psychosocial, cultural, social cultural factors: high HIV stigma and discrimination, poor attitude to regular of condom, religion, beliefs against condom use, gender inequalities, including gender-based violence, and widespread use of alcohol and other drug abuse. High risk sexual behavior characterized by high incidence of concurrent denial and marginalized of LGBTIQ groups. Biological factors including men circumcision in high prevalence, sexual transmitted infection. Economic factors: labor migration, increased across the border travel, poverty and inequalities, and vulnerability of adolescent women and children. Political factors including internal and external conflict, poor enforcement and anti-discrimination laws, weak social legal protection of vulnerable populations such as irregular migrants, sexual minorities, and inconsistent political support will, among the others. Legal provision, facilitation to a supportive environment for sex workers in Kenya. The Constitution of Kenya the 2010 Constitution, the Health Act number 21 of 2017, the HIV/AIDS Prevention Control Act, the one that was done in 2016, HIV laws and policies that address violence in Kenya, HIV and AIDS policies, guidelines, and strategies on key populations. Legal provisions hindering a supportive environment for sex workers in Kenya. One is the Penal Code Cap 63 of 2009, the Sexual Offences Act 3 of 2006, Public Health Act Cap 242, and county laws. Interventions for sex workers. We have 3 interventions. One is biomedical, behavioral, and structural interventions. Headlines on human rights violation, counties that have decriminalized sex work in Africa. So we have the sex worker-led organization in DRC issue a statement in the wake of escalating violence against sex workers. We have DRC sex workers demanding greater protection during COVID-19 pandemic. Then we have CAFOC TS issues a statement on human rights abuses against sex workers in the Central and West Africa. Sex workers in South Africa ignored by the state, abused by police. Sex workers lack food for taking HIV drugs and are targeted by police during the COVID-19. Uganda sex workers are targets for violence and further criminalizations. COVID-19 spread. In conclusion, as sex workers, we are at an increased risk of contracting HIV as a result of multiple factors and limited choices related to poverty, discrimination of sex work, and associated biological risk. Both criminalization of people living with HIV and of sex workers can compromise quality of healthcare and access to important services. The laws tend to endure the provider-patient relationship or negative effect provide attitude resulting to discriminatory healthcare delivery that can either affect negatively or affect provide attitudes, drives people away. Essential services including prevention, treatment, and care for HIV, stigma associated with engaging in sex work has been shown to decrease as an individual's ability to access care, including any other healthcare service that is needed. Fight back against violence from clients, intimate partners, and law enforcement. Fight back against violence from clients, intimate partners, and law enforcement. Discrimination severely limits our ability to work in a reasonable, safe environment and to control our choices about HIV and STIs transmission. Risk reduction, such as condom use, law enforcement officials in a number of judiciary also routinely use the possessions of condoms as evidence of intent to solicit further undermining our safety. A better understanding of the linkage between HIV discrimination and criminalization of sex work can help us mount a stronger movement against stigma, barriers to essential public health programs, and discrimination.